Hello, my name is Wiley, and this is my attempt to make a YouTube video that will describe my hiatal hernia operation, pre-op and post-op. Approximately 6 days ago, I had hiatal hernia surgery, and I will start at the pre-op and tell you what I went through. And first of all, I'd like to thank those that have given their reports on the hiatal hernia and the different complications or things that have happened or how good the surgery had turned out. From other people out there on YouTube, I sure appreciate that, and I hope to put in my 2 cents worth. Well, the pre-op test for the hiatal hernia, it started a long time ago. First, I had an MRI on my back, my entire back from the neck all the way down to the lumbar, because I had back problems. And to make this kind of short, when they did the MRI, besides my degenerative back, it showed up that I had 2 nodules on my lungs, and also I had a large hiatal hernia. And I did not know what a large hiatal hernia was at that time. So after talking to my primary care physician, and he said, well, let's get a CT scan so we can get a little bit more detail. And it showed up, of course, the nodules on my lungs and the large hiatal hernia, which was 10 centimeters. From what I understand, that's about 2/5 of your stomach is 10 centimeters. So from that point, we wanted to make sure that the nodules on my lungs weren't changing at all. So I had to have another CT scan 3 months later to verify that the nodules were there, and it could have been from Agent Orange, as I'm a Vietnam veteran, or it could be from smoking that I quit about 25 years ago. So I went to a surgeon that was recommended to me for possible hiatal hernia surgery. And he had me do an upper GI, and that's with the barium, and you drink a couple of different things to see if your food's going down. My symptom was not a GERD like acid. That was about a year ago before this turned up here. I had some acid reflux and took some antacid pills over the counter, and they worked, and I didn't have any problems. And then lately, I still didn't have any acid reflux, but I was having issues swallowing, and I could only eat a little bit at a time, and then I would wash it down with something, whether it was juice or soda, anything that would just wash it down to make sure it was getting down into my stomach, it felt like, kind of hanging up in the esophagus. So I explained that to the surgeon, and I said, well, no, I'm not having a lot of acid reflux, but I cannot eat without drinking something all the time to wash it down. And he said, well, he says, that's not a really good sign. So that's when they did the upper GI. And yes, they found, I had an endoscopy too. The endoscopy also showed the 10 centimeter hiatal hernia. And then the upper GI was another confirmation. Of course, you got to take all of these tests or the doctors won't do anything, and they want to make sure that what they're going to do is going to be beneficial for you. And I appreciate that. So right a week before I had my surgery, I went in for a pre-op test, and that was a blood test and an EKG they had to have before the hiatal hernia surgery. So it was scheduled for June 3rd, the hiatal hernia surgery. So, of course, I never knew what to expect. I've never had any surgery before. In fact, I never spent a night overnight in the hospital since I had my tonsils out when I was 4 years old, which, as you can tell, was a long time ago. So the doctor, the surgeon, does the Nissen Fundoplication. I think I'm pronouncing that right. the Nissen Fundoplication, which wraps the stomach 360 degrees around the esophagus. And I guess that's the best way nowadays to do that. So when I went in to get prepared for the surgery, of course, they shaved my stomach and abdomen area, started an IV. They also gave me some antibiotics, and also there was an option to have a pain block for the incisions. Of course, it's laparoscopic, so they're small incisions. But there's some type of a pain block they offered me, and I said, well, if it's going to help with pain, sure, I'll go ahead and take that. And if I forget to mention that later, that pain block for the incisions lasted about 24 hours, I would say, after the operation. So they got me prepared, and I went into surgery, and I don't remember anything except the anesthesiologist putting an oxygen mask over my face and saying, we're going to give you some oxygen, and boom. And that was the end of it. I don't remember anything else. The operating room was scheduled for 2 hours and 20 minutes. I have not asked the surgeon yet. I have to have a follow-up in a few days to find out if he used the entire 2 hours for operation and how the operation itself actually went. As I mentioned, I have a follow-up with the surgeon, and I'm going to ask him some more details on the actual operation, what he saw, what he expected, what he didn't expect. Was my large 10-centimeter hiatal hernia one of the largest ones he's worked on, or is it common? And was there any complications he saw? All these questions I'm going to ask next week when I see him. As I said, it was on Monday the 3rd, and today is the 9th. So we're looking at just 6 days ago. And I'll try to explain day by day. I kind of made some notes, and hopefully this helps you if you're deciding to have hiatal hernia, or if you have had it and want to compare it to me. So the first day, and when I got back into the recovery in the hospital, I spent one night in the hospital. I just remember waking up and having extreme pain in my left shoulder, and I understand that was from the CO2 that they blow you up with so they can have more room or see what's going on when they do the operation. It was extremely painful. I had a large ice pack on my left shoulder, and I did have some pain medication, the Norco, hydrocodone, but it was very discomforting, to say the least. And my incisions didn't really hurt too much. But let me take a look at some of my notes that I have here. Oh, by the way, the surgeon, when I saw him before I left the hospital, said, yes, you had a, quote, legitimate, very large hiatal hernia. So in the hospital, after I recovered, I could talk to my wife and my stepdaughter. It was just a really bad pain in that left shoulder.